Today I spoke with a man that I happen to like. I spoke with Phil in New Jersey, and we're going to be doing something very meaningful in New Jersey. We're doing something. I spoke with J.B. Pritzker, called me today. We're going to be helping them out in Illinois. We're doing a lot of things in Florida. We're doing a lot of things.
All right, we've been listening to the coronavirus task force briefing this afternoon. Some big developments coming forward this afternoon. Perhaps the most promising is a clinical trial that begins tomorrow in New York using a malaria drug and a Z-Pack, that's some antibiotics, to see if it is effective against coronavirus.
And then they will reassess the situation in 7 days, which is the end of the stay-at-home rule, by the way, of 15 days. Although this may be somewhat optimistic, they are in fact adamant that people still maintain the social distancing rule. KCAL 9 News at 4 starts right now.
Today we're reporting 128 new cases, and I'm really sad to report an additional 2 deaths.
An alarming rise in the number of coronavirus cases in LA County. This as officials send out a stronger warning on social distancing.
As you just heard, LA County recorded 128 new cases in the past 24 hours. That brings the total of number of cases to 536. 7 people in LA County have now died from COVID-19. Hello, everyone. I'm Sharon Tay.
And I'm Juan Fernandez. This is KCAL 9 News at 4, and we're streaming on CBSN Los Angeles. Well, the disturbing numbers across the region are not unexpected. That's according to health officials.
But they're saying the public is not doing enough to slow the spread. KCAL 9's Dave Lopez is live with a deeper dive into those numbers and the warnings for you. Dave.
Well, a number of things to report today at this briefing. It was a wide-ranging briefing. There's going to be a number of more tests. A Korean company is going to provide Los Angeles. Los Angeles is going to pay for them to the tune of $1.2 million, I believe the figure was. LA companies are now coming forward and starting to manufacture things that are needed at the hospital. As one of the city council members said, this is only the beginning, and the numbers went up, but that's to be expected, and they'll continue going up because more people will be tested. But the dire warning is still out. Don't think just because you're young that you are not susceptible to this disease.
Crucial for all of us. Dave, thank you. The Navy hospital ship Mercy is on the way to Los Angeles. Its 1,000 beds and personnel will help ease the soon-be overwhelmed hospitals, but it's not for coronavirus patients. KCAL 9's Rachel Kim is at the Port of LA, where the ship will be based, and a look at its mission.
This is the massive hospital ship USNS Mercy at Naval Station San Diego as it departed for the Port of Los Angeles this afternoon. When it arrives, it will treat non-coronavirus patients in need of care. Its mission is to lift the burden on area hospitals so they can concentrate on COVID-19 cases.
Biggest hospital in LA is about to land right at the Port of LA.
Today, the Navy's top medical authorities told CBS News that their staff of 800 active duty medical personnel and support staff are coming from Navy hospitals and know the Mercy. They're prepared to offer a wide range of services, including critical and urgent care for adults. They will not be providing obstetric and pediatric care. There are 1,000 beds, and they plan to staff 9 of their 12 operating rooms. Navy officials say patients will come to them as hospital transfers.
We'll work very closely with our neighbors there, Long Beach and others, to make sure that that is available to everybody no matter where they live.
The move comes after Governor Gavin Newsom wrote a letter to President Trump last week requesting the ship be sent here, saying they expected more than half of the state's population will be infected over an 8-week period. President Trump and federal officials later announced that the Mercy would head to Los Angeles. The ship was supposed to be based in Seattle.
Even though there are more cases right now in Washington, the projected needs for beds in California is 5 times more.
The commanding officer for the Mercy says they will have coronavirus tests on board, and if someone tests positive, they'll be transferred off the ship. Navy officials say the Mercy is expected to get here within the week, and they'll be able to treat patients the day after they arrive. They plan to dock here as long as necessary. Reporting from the Port of Los Angeles in San Pedro, Rachel Kim, KCAL 9 News.
As the pandemic worsens, LAUSD has announced it's extending its closures through May 1st.
KCAL 9's Joy Benedict shows us what this means for students, families, and the school come the fall. The city of LA is doing all it can to help the homeless during the pandemic. In addition to shelters, it's opening dozens of recreation centers to get people off the streets and out of danger. KCAL 9's Chris Holmstrom has more on the centers and why not everyone is taking up the offer. Well, Wall Street took another huge hit today with lawmakers failing to pass that stimulus package. The Dow closed down 582 points. The Nasdaq was down nearly 19 points, and the S&P 500 was off by more than 67 points.
Well, a lot of nurses, local nurses, are concerned about the coronavirus pandemic. What they want everyone to know.
Plus, now hiring, many businesses are looking for employees, while others are laying off workers. The impact the virus is having on our economy.
I'm Christine Lazar with mortgage payments looming and the property tax deadline just a couple of weeks away. We'll break down what relief is available for homeowners.
The coronavirus pandemic has left countless people out of work and concerned about keeping up with paying their bills.
That's right. KCAL 9 consumer reporter Christine Lazar joins us live now with a look at how to navigate mortgage and property tax payments coming very soon, Christine.
Yeah, Juan and Sharon, it's tough because we're just a couple weeks away from that property tax deadline. And we keep hearing that there are programs out there to help ease the pain that these homeowners are feeling during this epidemic. But you have to be proactive in order to get some of that relief. It's a stressful time to be a California homeowner, with mortgage payments looming and state property taxes due in a couple of weeks. Thankfully, there are programs in place to help. Devin Thorsby is the real estate editor for U.S. News and World Report.
First and foremost is to contact your lender as soon as possible, as soon as you realize that you do not have a regular paycheck coming in. Your lender does not want to foreclose on your home. It's bad business for them as well.
Governor Newsom has halted all foreclosures until the end of May. Mortgage giants Fannie Mae and Freddie Mac have both ordered lenders to reduce or suspend payments for up to 12 months. And most other lenders are making accommodations as well. But you don't want to just stop paying your mortgage. You need to contact your lender and work to create a payment plan. Beware of the difference between a loan forbearance and a loan modification. A forbearance could mean that you'd have to pay back all the missed payments in one lump sum.
A loan modification allows you to work with the lender, figure out the best option for you individually, working with your lender to either suspend payments for a certain period of time and adjust the payments later on, or even reduce the payments now.
Despite the coronavirus, state property taxes are still due April 10th. In a message on its website, the LA County tax collector writes, "We have no authority to extend the April 10th deadline as outlined by state law." So even though their offices are closed, the county expects property taxes to be paid on time. However, late payments may be waived if a homeowner is unable to pay for reasons related to COVID-19. Requests must be submitted online and only after April 11th. And Riverside and Orange counties have similar programs. Now, LA County says if you can afford to pay those property taxes on time, they want you to do it. They say they use that money for critical services that are especially needed right now with us being in this state of emergency. I want to add that I'm a homeowner and I went online this morning to my own lender to see the process to change how I pay my own mortgage. And I want to warn you, it's extensive. It's not just click a box or make a phone call. So if you think that you're not going to be able to pay your mortgage on time, you need to act now. Don't wait until the 31st, because as I saw, you not only have to fill out a lot of forms, almost as though you're applying for a new loan, you also have to upload documentation that you may need to get from your employer or from unemployment. So the key word here is be proactive, act now. Back to you guys in the studio.
Yeah, sounds like we have to plan ahead.
A lot to think about. All right, thank you so much, Christine.
Okay.
Well, the rain has moved out, and guess what? Some more is headed our way.
Unfortunately, a brief reprieve, but look at that shot of Long Beach. What a gorgeous shot. Let's go to meteorologist Amber Lee with more on our forecast this week. Hi, Am.
The coronavirus pandemic is hurting everyone. The number of Americans affected by business closures is staggering.
Yeah, how many people are expected to lose their jobs in the coming weeks? We'll have details just ahead. Well, the coronavirus is causing so many businesses to close, and millions of people could lose their jobs.
Indeed, KCAL 9's Jerika Duncan takes a closer look at how small businesses are being impacted.
Greg Fletcher and his business partners spent 2 years preparing to open Axe and Arrow Brewery in New Jersey. Now, just 2 weeks away from their 1-year anniversary, the business is facing an uncertain future.
What's your concern for business owners like yourself?
There's a real threat to a lot of small businesses. We're paycheck to paycheck, week to week. That revenue has to come in, or it's problematic.
Fletcher says they have a small cash reserve and their customers are still able to pick up beer to go. When we talked to him Sunday afternoon, he'd only made 2 sales that day. One during our interview.
How scary is that for you?
It's worrying. Yeah. If this obviously extends out into 3 weeks, it's not going to be enough to cover all of our expenses.
He stopped scheduling his 4 part-time employees as businesses around the country face the same tough decisions. The closures have been especially hard on retail, hospitality, restaurant, and travel industries.
There you go.
Roughly 82 million people, that's 3/5 of the U.S. workforce, are hourly employees. Most won't be paid if they don't work.
I'm scared.
Kanika Rice worked at Johns Hopkins University as a cook, but is now out of a job. She says she makes 65% less on unemployment compared to her regular pay, and says it's not enough to support her 3 children.
What I get in unemployment is just enough to survive on a daily basis where I'm at now.
Kelly and Nathan, who asked us not to use their last names, decided to leave New York City to move in with family in Virginia. Nathan lost his job as a coordinator for a nonprofit. Kelly's job in retail e-commerce was furloughed without pay.
It's all very uncertain at this point. But yeah, if and when I get the call to come back to work, I will be there without a doubt.
Jerika Duncan, New York.
Well, companies closing and laying off workers is one side, but believe it or not, some businesses are looking to hire. Where you can apply, coming up.
It's the only hospital in Southern California taking part in a clinical trial for the treatment of coronavirus. I'm Michelle Geely. I'll have the answer of where this is happening coming up.
Now at 4:30, a potential game changer in the fight against the coronavirus pandemic. Clinical trials for a promising drug treatment are now underway.
And one of the research centers involved is at UC Irvine. KCAL 9 Orange County reporter Michelle Geely has more on the work being done in conjunction with the National Institutes of Health.
This is an antiviral drug, so it seeks out the genetic code of the virus, and as it seeks it out, it goes and attacks the virus and destroys it.
UC Irvine Health and Medical Center in Orange is the first and only Southern California hospital to conduct a clinical trial on a drug to treat COVID-19 or coronavirus.
We did not have any active known treatments for coronavirus due to the unique nature of remdesivir. We're optimistic that it's got some properties that will attack the genetic code of the virus. We have seen its usage a little bit in MERS and SARS in the past, and it was originally used for Ebola in Africa.
People who test positive for COVID here at UCI Medical Center could be enrolled in the clinical trial. However, doctors say they must have serious symptoms and must be hospitalized in order to qualify for the inpatient trial. The antiviral drug called remdesivir is given intravenously. So far at UCI, 1 patient has been admitted to the double-blind trial that began here Friday. That means neither the doctor nor the patient knows whether the drug or a placebo is being administered.
If a trial is coming out to be very, very positive, meaning that the results in the treatment arm are very good compared to the placebo arm, at that point in time, sometimes a trial could actually be stopped, and the FDA could review the data at that point in time and decide whether it wants to approve it at that point in time.
Excluded from the UCI clinical trial are pregnant women and those with kidney or liver problems. In Orange, Michelle Geely, KCAL 9 News.
Some local nurses upset over the protection during the pandemic, what they say they need.
Also grounded during the coronavirus pandemic, how many planes are parked instead of in the air right now.